How hard can choosing a mask be? Wait, okay. I like this one. Okay, wait, no. Too many straps. This one. This one's similar. Tubes on top. Okay. I think I'll take this one. Okay, wait. Oh, this looks comfortable. It's elastic, right? Oh, but I don't like it going to my nose. But I think I breathe through my mouth. Will this be more comfortable? Okay. Oh, which one? Okay, now I'm confused. Hi everyone, I'm back. Okay, today we're gonna talk about mask fitting. Okay, why mask fitting, right? A lot of people think that mask fitting is a very simple process. It should be done in 10-15 minutes. Well, I wish it was that way, but it's not, okay? So our usual mask fitting sessions, well, we've got two sessions, or rather two types of mask fitting sessions. The first being the standard mask fitting session, which takes about an hour. And the second, which is mask fitting with pap nap, which allows the patient to take a nap, a 1 hour nap, to see if the mask he or she has chosen is the right choice, or rather the best choice. So a very common question that we get from patients, or I get from patients, is, hey Michelle, we've been doing this for so many years, or a few years at least. Which is the best mask, or which is the most popular mask? I want the most popular mask. And I tell them, no, there is no best mask. And this is not bubble tea, you don't go for the most popular flavor or what's trendy. You need to try in order to find the best mask for you. Okay, there is no one best mask for everybody. Why? All our facial features are different. I may have a flat nose, you have a sharp nose. I have fat cheeks, you have sunken cheeks. Yeah, so what is best for me may not be best for you. Yeah. Okay, so what are some things we need to take into consideration when doing mask fitting? Okay, firstly, whether the patient is a mouth breather, right? So that's pretty important, right? There's no point giving the patient a nasal mask if the patient cannot breathe through his nose at all. Yeah, so that is one of the more important things we take into consideration. The second thing would be perhaps threshold for discomfort. Yeah, there's some patients who cannot sleep with new things on them, on their face, on their body. They can't even fall asleep as long as there's something which is not the norm on them, right? So with patients like that, we would probably need to choose masks which are less obtrusive, right? Something which doesn't cover too much of the face, especially if they're claustrophobic. Shouldn't cover too much of the face, shouldn't have too many straps. So the other thing would be, okay, does the patient just sleep on his back for the whole night? Or does he flip around a lot, roll to the left, roll to the right, throughout the whole night? So if the patient rolls here and there and everywhere, it might be good to actually take a mask with the tube on top. Yeah, so there are a lot of factors that we need to think about before recommending the patient a mask. Yeah. Okay, so why do I need an hour for a standard mask fitting session? At the start of the session, I introduce the patient to the machine. We're talking about CPAP trial, right? Mask fitting for a CPAP trial. So we introduce the patient to the machine. I do the settings in front of the patient. I explain why I'm setting certain settings for the patient. And basically, I go one by one and tell them, okay, your maximum pressure, the maximum pressure I'm setting for you is 10, why am I doing this, okay, what is Smart Start, what is EPR, which is expiratory pressure relief. Okay, and how the humidifier works, why it's important, why there's a heated tube that comes with the machine instead of a standard tube, how it helps. Yeah, so that itself is going to take maybe like a good 5-10 minutes. Yeah, and of course, like remind the patient how to take care of the machine, top up your water, wash the humidifier chamber every day, wash the tubing every week. Yeah, things like that. Okay, so that's gonna take about 10 minutes already. Okay, so when we go to mask fitting, right, the first thing I normally do is to actually showcase all the masks that I have. I usually show 6 masks. So we're looking at the ResMed F20 full face mask, the ResMed N20 nasal mask, the N30i nasal cradle mask, the P30i, which is the version with the nasal pillows, the Philips DreamWisp, and the P10, right? The P10 nasal pillow mask. Yeah. So I would actually go through the pros and cons of each of the masks, right? So I would tell them, yes, my personal favorite is the N20, right? I use the N20. I think it's comfortable. But no, it doesn't mean that you should get the N20 because I said I'm using it. Yeah. So N20, well, the disadvantage is well, if you're claustrophobic, you may feel uncomfortable because it feels like someone's grabbing your head. That's what someone told me. That's what one of the patients said. Same for the F20. Some patients feel very suffocated because it basically covers like almost half your face. Yeah. Okay, and tube on top, what are the pros, what are the cons? You may need to tighten more for the N30i. Yeah, things like that, right? Every mask has its pros and cons, right? I haven't found a mask that is perfect. No cons, just pros. No. Yeah, so that is how I start off. And then I ask the patient, okay, gut feel, which mask you like to try first. And from there, right, we by asking that question, we get a sense of what the patient prefers, a tube on top. A patient doesn't like stuff that go into his nose, nasal pillows. Yeah, so each mask, so what we do is, okay, patient picks first mask, I let him try it, I turn off the lights, I let him, try it for like 5-10 minutes, right? I leave the room, I come back and ask him how it was based on his feedback, right? I would perhaps suggest another mask, which may be better, may not be better, but yeah, just for variation. Yeah, so if every mask takes about 5 minutes, 7 minutes, plus feedback, plus little discussions in between, 1 hour, it's not very long. Yeah. So so the thing is, I can never understand why patients come and say, oh, why 1 hour? I've done this before. The last mask fitting I did was just 10 minutes, and I'm like, 10 minutes? Like, what do you do in 10 minutes? Okay, so what I realized is that, for some vendors, this is what I heard from the patient, okay, that they simply pass the patient a mask and say, hey, use this mask, this is good for you. The patient says, oh, but this looks very scary. I don't like things on my face, I don't like things that are too big. No, you get used to it. You'll get used to it. That's not how it works. I mean, at least not for us, okay? I think we should try our very best to find the patient a mask that he or she is comfortable with, right? Well, yes, sometimes you cannot find the perfect mask, as I mentioned, but at least the best choice out of whatever you have in hand. Yeah, you can't just force something down the patient's throat. Yeah. Then why the pap nap session, right? So I say there's a 120-minute session. Okay, there are some patients that find it really hard to decide because either they don't like everything or they like everything. Yeah. So what I normally do is we will get them to shortlist maybe 3 out of the 6 masks. And concentrate on the 3 and maybe take like a 20-minute, 30-minute nap with each of the masks, depending on how many masks the patient has chosen. And that really helps a lot because usually by doing so, the patient can actually, well, more or less see if they can fall asleep with the mask they've chosen, or if, it's just so uncomfortable they can't even foresee falling asleep with it. Yeah. So mask fitting or choosing the correct mask plays a very important part in the patient's decision to continue CPAP therapy or not. Yeah, it's more important than you probably think. Okay, so what's going to happen if patient has got an ill-fitted mask? Okay, firstly, you get a lot of leaks. Patient's going to be disturbed by the leaks. Bed partner is going to be disturbed by the leaks throughout the whole night. Okay, not only that, patient's going to is going to experience a surge in airflow, right? Why? Because when there's a leak, machine tries to compensate for the leak by increasing the airflow so as to maintain the pressure. Yeah, so it's all going to get very uncomfortable and some patients may just give up. So the next time you know of someone who's going for his or her mask fitting, tell them not to rush. Yeah, when choosing a mask, they need time to compare, they need time to try the mask. If possible, all the masks, in order to find the most suitable one. Yeah, so such things cannot be rushed, and mask fittings cannot be done in 10 to 15 minutes. Yeah, okay, so that's all for now. Till next time, bye.